Today's episode goes out to everyone who is in their family planning stage, who is looking to conceive for the first time, or to optimize before having their second, third, or even fourth child, or someone who has been trying to conceive and is looking to learn about how to advocate for themselves and explore some potential root causes of fertility struggles if that's something that you're currently experiencing. Dr. Elizabeth Wade is a licensed naturopathic doctor specializing in reproductive and gut health with over 15 years of experience. She operates a private practice in Portland, Oregon, and she speaks about fertility in such a compassionate way. She conceived her 2 children at ages 33 and 38, and she is so knowledgeable in this field, a true dedicated advocate for women facing menstrual cycle imbalances, infertility, subfertility, and she provides comprehensive support throughout preconception, pregnancy, and the postpartum phases. In this episode, we're going to discuss, of course, the preconception period, how to prepare your body for a healthy pregnancy. We're going to chat about the different lifestyle factors that have the greatest impact on that preconception period. She'll share why men's role in fertility is equally as important as the woman's role and why there's this disparity that we're seeing in the emphasis put on women's health. She'll share why you have this incredible opportunity every 3 months to actually optimize and change the genetic expression of your DNA for healthier outcomes and healthier babies, the difference between infertility and subfertility, which are 2 different things, why fertility rates are declining in the first place, as well as different factors like tubal, pelvic, and cervical factors. We're going to talk about everything from vitamins that we need in preconception, like methylfolate and methylated B vitamins, all the way to cleaning up our beliefs, what she calls belief hygiene around pregnancy, fertility, and some nervous system support that you can do in prep for pregnancy. She's going to cover how to understand and interpret labs like AMH, which is a very popular lab for young women or women of any age looking to conceive. And she's going to chat about other recommended labs within the panel that she uses for preconception. But more than anything, she's going to talk about if labs like AMH are even necessary or if they can just only create extra anxiety for women. We'll talk about the importance of testosterone for male fertility and how to optimize that. We'll talk about the importance of testosterone for male fertility and how to optimize that. Nutrient deficiencies in men, the ideal preconception diet, why metabolic issues, cardiovascular disease, insulin resistance, and type 2 diabetes can affect fertility and should be addressed as part of a holistic approach, why liver and organ meats can be so crucial and other nutrients needed for fertility like omega-3s, why choline is an important nutrient for brain development in babies that is extremely hard to get through diet and why she often recommends supplementing. And she's going to chat about other specifics like this unique combination of melatonin and CoQ10 for both male and female fertility and some studies around that. So really nitty gritty, but also high level, just like some regular old dietary pillars and guidelines to follow and some low touch, low hanging fruit things that you can do and follow to really optimize your health and fertility. This was such a comprehensive conversation. And of course, again, like many practitioners on this show, she has some beautiful offerings like a fertility reclaimed course that you guys can take if you don't want to necessarily work with someone one-on-one, but you want to get some more of this detailed, personalized information and support. That's a great resource. And we talk about that at the end of the episode. So I hope that this episode is immensely helpful to you. And because this is an episode focused around fertility and hormone balance, and menstrual cycle health, I'm going to be offering 15% off 3 of my formulas in my apothecary as an herbalist that can be extremely supportive in your fertility journey. The first formula is Flora V, which is our newest blend. That's my women's health vaginal probiotic that contains very unique lactobacillus strains that are key for the vaginal microbiome. And in fact, our vaginal microbiome is so important for our fertility and is one of these missing links that we don't often think about. Flora V contains not only lactobacillus strains, but also lactospore, which is this revolutionary spore-based probiotic that helps the survival and the diversity of other good bugs within the vaginal flora. And it also contains a beautiful cranberry extract that, of course, is high in polyphenols that boost all of our happy and healthy gut and vaginal bugs, but also help to fight off imbalances within the urinary tract and the vaginal tract. I'm also offering 15% off of Natal Nourish, which is my preconception fertility herbal formula full of deeply nourishing plants that help to support follicle health and uterine health, things like red raspberry and nettle that deeply nourish and provide key minerals within your preconception regimen. And finally, Flow Balance, which is my tincture for women who are maybe experiencing some irregular cycles and actually need to optimize their hormones as a whole, like estrogen and progesterone, before even trying to conceive and having a consistent ovulation date. So for many people, I find that utilizing Flow Balance first for 3 to 6 months to help regulate that cycle and regulate FSH, LH, and progesterone levels is a really great way to start. And then you can move on from Flow Balance to the combination of Natal Nourish and Flora V to help to really nourish and provide that nutrition and that ideal vaginal microbiome as you go into your TTC phase. So you can get 15% off of Flora V, Natal Nourish, and Flow Balance by using the code fertility15 on organicolivia.com. That's fertility15 on organicolivia.com. And thank you so much for supporting the show and my formulas. Let's get into the episode. Okay, are you ready?
We feel each other's emotions.
It's everything. It's living my life intentionally.
That's the message, right?
Absolutely. There's no difference between our mental health and our physical health. It's the same exact thing.
And without further ado, let's get juicy.
Hi. Welcome to What's the Juice, Dr. Elizabeth Wade, for the second time.
Thank you so much for having me.
It's so nice to have guests on the show twice because I really get to know you and your work, and the audience gets to know you. This episode's topic is preconception, fertility, as well as infertility, which is on the other side of that.
I would actually say it's my original, it's my oldest area of expertise. It's the thing that really, very early in medical school, year one, that I was really pulled to. And so I've been really deeply studying this and trying to push this message of the importance of preconception work forward for a long time. And I'm just super grateful to have the opportunity to share that with your audience.
Before I ask you why infertility is on the rise and the trends and the statistics that we're seeing, I want to ask you what preconception is, because I feel like I only just started hearing about that term 2 years ago, whereas we used to just jump into getting pregnant and not think about the year before.
Yeah. So preconception work, I think ideally should happen in the 1 to 2 years before you try to conceive. And your guests are probably already doing that without knowing. They're thinking about their nutrition, they're thinking about their exercise and adrenal health and gut health and all that stuff, environmental toxin exposure. So that is all part of preconception work, just kind of like cleaning up your environment, cleaning up your internal terrain, your external terrain, right? But there's this phrase called the trimester, which is like the 4-month period before you actually conceive, which is this critical window of opportunity because it's when our follicles, so we have all the follicles we'll ever have at birth. Mm-hmm. Actually, at 20 weeks gestation, when our mother was in our grandmother's belly, all the eggs we will ever have were there. So it's wild, the epigenetics that we know of, from grandmother to granddaughter is really influential. So everything, right, from what your grandmother was doing, her nutrition, her lifestyle is going to impact, your child as the mother. But this 4-month period, this 120 days essentially, is when we kind of recruit the follicles that we're going to ovulate out 4 months later and mature them. So even though we have those follicles, and some doctors will use the term old eggs when women are advanced maternal age over 35. Mm-hmm. My sister was definitely told she had old eggs by her OBG, which is really not a kind term. Nobody wants to hear that. But the reality is we all have old eggs because they've been there the whole time, since, before we were even born. But we have this window of opportunity of when we're maturing and developing those eggs to be ovulated out to really change their expression and to change the genetic expression. And men have, the spermatogenesis cycle is 90 days. So every 3 months, they get this brand new opportunity to, create a totally different spectrum of health for their sperm health based on their environmental and lifestyle and nutrition status, et cetera, the supplements they're taking. So that 3 to 4 month window, but really 4 months, is great because we don't know where men are at in their spermatogenesis cycle, is important to kind of catch the whole thing, optimize things so that when we do conceive, the chromosomes and the DNA that we're passing on to our baby is the best possible genetic expression that we can give them.
I love that in your work around preconception and fertility, you speak so much about men and also optimizing sperm health and the fact that there's this epigenetic DNA expression component there, because I feel like so much of the onus surrounding fertility and the health of our children is put on the women.
Totally.
And we often think that there's automatically something, quote, wrong with us or suboptimal within us, when in reality, I've read studies about how a father's alcohol consumption, in the year before conception can have a massive effect on the child's genetic expression, their muscle mass. I think it was like a proclivity towards a hormone issue. I mean, it can just affect so much.
It really can. Yeah. And when I speak of men and women, I just, want to say that that's what we have studies on. And so I know there are other genders and, other binary groups so I don't want to exclude anyone from this, but the research that we have is on men and women. So when I use those terms, that's why I'm using that. But there's many different formulas in which people can conceive, however they identify. But yeah, I mean, with men, the research on alcohol really shows that it changes the shape, the morphology of sperm. It changes like the ejaculate volume. So if you don't have enough volume, right, then you have less sperm count. So alcohol has a huge impact. And, there's a lot of really concerning research around men specifically with declining fertility rates. 2 generations ago, all men would have been considered, like now, infertile. Like the statistics that we have now in male fertility, they would have been in the infertile group 2 generations ago, based on the World Health data, like parameters of what is like a fertile man versus a non-fertile man.
You're saying in the context of how healthy men were 2 generations ago,
right.
If we were to compare those markers, nowadays men would be considered infertile.
Yeah, so the World Health Organization has this chart that shows like the healthy sperm parameters for morphology, which is the shape, and motility, which is how well they swim, and count, how many sperm there are. And so those are there's more extensive elaborations of that, but those are the basic parameters we're looking at. And the latest update is from 2010, but we have had to continually lower the standard that now if you are in the 5th percentile, it's considered normal. So the 5th percentile, it's considered normal, which is not the same as optimal, right? And so data from, I think it was 1973 to 2019, shows that the normal count has gone down by 50%. So it used to be what normal was 104 million per milliliter, and now it's 20 million per milliliter is considered okay, but the best would be 45. So 50% of it.
I'm sure all of us listening right now want to ask you immediately, why is that? Tell us all the things that are wrong with our world. But at the same time, I think it's so frustrating because when you go to Western medicine doctors and you get your labs drawn, you're told everything's normal. You're told your liver knows how to detox. It doesn't need support. And you're told that essentially all toxins and chemicals are fine. They're just chemicals. And that's not that I'm the full other side crusader of the purest non-toxic living. We all know this. I'm very balanced. But it's so frustrating to hear those kinds of answers from doctors and then hear these statistics. So where is the disconnect?
Yeah, I mean, the environment is huge. I think for men, the environmental toxicity is the biggest piece because oxidative damage is the biggest contributor of male infertility. And that can come from smoking cannabis or tobacco or drinking alcohol or diet or toxins. I mean, there's just a number of ways, right, to ingest toxins in the body, whether it's through their skin or breathing them in or ingesting them. So I think that is a huge piece. And yeah, I mean, I always tell my patients, if your partner's had a semen analysis, I want to see it because they could be told this is normal because they're meeting that criteria to be in the 5th percentile, but that's not where we want it to be optimally, right? We don't want 20 million per milliliter. We want at least 45 million per milliliter to have the best chance of natural conception. So there's a lot we can do, and men have this beautiful opportunity every 3 months essentially to completely change. They can have a horrible semen analysis and they can make changes and, eat better and take supplements that are high in antioxidant quality, and they can completely see that reverse. It's actually pretty easy if they're willing to do that. Homocysteine, for example, is a lab marker we can test, and it's kind of a sign of inflammation in the body. And when men have high homocysteine levels, that can be a contributor to miscarriage for women. So, women that miscarry, they often just 100% assume it's me. I couldn't maintain the pregnancy, right? But it could be the male actually causing that miscarriage. So we really need to be looking at both.
Can you tell us what homocysteine measures exactly?
It's just a marker of inflammation. It has to do with methylation. So methylation defects, you've probably heard of MTHFR mutations. And so you can have homozygous mutation where from both parents you weren't given genes that are able to methylate basically vitamins like folate. You can't turn folate, which is a natural B vitamin found in leafy greens and different vegetables. And in order for your body to recycle it and utilize it, it has to methylate it in the body. Kind of leads naturally into, the most common nutraceutical people know about taking is folic acid for pregnancy. But folic acid is synthetic. We want to take folate, and ideally we want to take methylfolate, because if you don't know your methylation capabilities, why not just take the one that's already in the form that your body can just utilize instead of just hoping that your body can do what it needs to do with it.
So we know that folate and hopefully methylfolate are in the prenatals that women are taking. Does this mean that men should be taking methylfolate preconception as well in order to get their homocysteine down perhaps and lower inflammation?
Yeah, so you can lower homocysteine with B vitamins, B12 and folate. Some of the other B vitamins can really lower that. Other antioxidants can help with it too. People can definitely test their MTHFR mutations. I usually don't. I just give methylfolate because most good quality supplements at this point will contain that. So we'll just move forward with that. Yeah, I mean, it's, people bring it back to like the preconception trimester work is like neural tube defects. This is, again, one of the most common pregnancy issues that people know about and why, most women know I should take folic acid or folate when I get pregnant. But a neural tube defect is going to begin happening at 17 days gestation. You are not going to know you're pregnant at 17 days gestation unless you go in and have an ultrasound. So, most women find out at 4 to 5 weeks, when they miss their period. That's 4-week mark, and then they'll wait a week usually. And so they'll find out sometime between the 4 and 5 week mark that they're pregnant. And at that point, their neural tube has already closed. So, you really need to have your folate levels and your B12 levels all optimized before you actually conceive, because that can be a reason why you have miscarriage or malformations, right? Congenital malformations, and you don't want to risk that for something that could have just been addressed if you had been doing trimester work.
So if you can accidentally get pregnant or if you are trying to get pregnant, make sure you've been on a prenatal with methylfolate for a period of months, ideally.
And if neural tube defects run in your family, or if you have an inflammatory bowel condition, which could lower your chance of being able to absorb nutrients from diet or supplements, then those are cases in which you actually take more than the recommended dose. So studies show that if you take 10 times the amount of the RDA amount of folic acid, if there's someone in your family that has had a neural tube defect on either end, male or female, that's the recommendation, and it can prevent, I think the stat is 71% prevention if, you do the really high dose. So this is where the nuance of working with a practitioner, right, can be really helpful.
Of course. Right. So can you explain to us the difference between infertility and subfertility, which is something you talk about, and then can you go into the different factors that contribute to these conditions on the female side and on the male side separately?
Infertility is a word that doesn't sit well and land well with most women. Nobody wants to be told they're infertile, male or female. It makes you feel terrible, and in this really primal way, we are wired to reproduce, and not every woman or man wants to have a baby, and that's totally fine. But once a person decides that they want to have a child, it's like this switch that gets turned on that becomes very heightened. Anything that could threaten that becomes a very stressful trigger, right? And so for women, you can be diagnosed as infertile if you're under 35 and you've been trying for 6 months and haven't conceived. If you're over 35, you need to have been trying for a year to get that diagnosis. And that's really just for insurance purposes. In the insurance world, they need these ICD-10 codes to reimburse. And so the medical system kind of sets up these diagnostic criteria, I feel, really for insurance, more than anything, but it can cause a lot of psychological trauma and stuff for people. Real infertility to me is being sterile. There's not a chance, right? You can conceive. And so the sterility rates are only 2% of men and women, maybe plus or minus 1%. That's what the current data shows. So really only 2% of people are truly sterile. They will never maybe be able to have a baby. But like the current, National Institute of Health says 9% of men, 11% of women be diagnosed with infertility. So that's like 10% on average. It seems much higher, right? So I really caution people, like, don't get attached. If your doctor has told you you're infertile, you don't like necessarily have to jump into IVF or something like that, because again, you can trimester, you can do this work, and you can see your biological aging reverse, and your fertility markers get better in most cases.
And so in terms of these causal factors or contributing factors that are creating this picture of subfertility for men and women, what are some of them for each of the sexes?
Yeah, I mean, it's kind of the same factors, I would say, that are contributing to hormone dysregulation in both sexes, which is environmental, like we said, gut health, which has our whole podcast we did a few years ago was all about how the gut microbiome influences our endocrine system. And that's all of our hormones, for your listeners who might be not familiar with that word. So, our sex hormones that produce our eggs and our sperm, which is estrogen and progesterone and luteinizing hormone, follicular follicle-stimulating hormone, and then our adrenal hormones, our stress hormones, cortisol, DHEA, those impact our sex hormones as well. And then we know blood sugar, right, is a big factor, a huge in influencing our hormones and fertility. So for women, all that aside, nutrition, maybe your genetic predisposition, right? Like that can all manifest differently. Like somebody could have dysregulated gut microbiome and they're getting really inflamed, but the way that presents and manifests in their body can look very differently, right? So some people will have a lot of skin conditions where it's, the atopic triad, the allergies, asthma, eczema. Some people, it's all stays in their gut where they have this really inflammatory, gut issue. And then for other women, it turns into insulin resistance and it becomes PCOS, and that in a lot of cases will shut down ovulation. So if you're not ovulating, you can't get pregnant, right? Or it'll make it really hard because there's such an imbalance in your hormones, even if you are ovulating on the PCOS spectrum, but maybe it's every 45 days or every 50 days, and it's really irregular, and there's not the right ratios, right, of things. And so PCOS, endometriosis, is really driven by inflammation, and a lot of women can, struggle with infertility from endometriosis. So those are, endometriosis and PCOS, I would say, are like the number 2 conditions contributing to like ovulatory factors. The thyroid, hypothyroidism can cause issues with ovulation. And
how does that connection work, hypothyroidism? And
yeah, so with the thyroid, it can mess with that HPO axis, or the hypothalamus pituitary ovarian axis. So someone will see their menstrual cycles being affected by, if they have unmanaged hypothyroidism. If you have Hashimoto's hypothyroidism, where you have the autoimmune component and you have high antibodies and you have a high TSH, that can increase your risk of miscarriage. It's associated with higher rates of infertility. And then with hypothyroid, there's this big gut connection, and a lot of hypochlorhydria, which is low stomach acid. So it's poor nutrient absorption. So then you might not be getting all the nutrients you need to build a healthy endometrial lining and to build a healthy fetus, right?
So you just mentioned a lot of kind of these root cause factors that one would address with a functional practitioner, like gut health, if there's gut infections like SIBO, if there's insulin resistance, which is creating a picture of high testosterone, which is blocking our luteinizing hormone spike and preventing us from ovulating. You're mentioning thyroid, so that's sort of a stress-based HPO issue, ovulation issue, but also could be immune-mediated because of the Hashimoto's piece. But you also talk about tubal, pelvic, and cervical factors. What are those?
I don't think anybody at this point is going to be surprised to hear that smoking tobacco is like really not going to be good for your fertility. It causes a lot of oxidative damage, but it can also impair what are called fimbriae, which are like these little hairs that kind of push the egg along in your fallopian tube. And so people who are smokers, or if they've had like gonorrhea or chlamydia or a UTI that's gone up, higher up into the pelvic region, they can have scar tissue and damage to the tubes, essentially, that can cause issues with the egg not being able to travel up the fallopian tube too.
Is this where some women do like that tubal flush?
They will do a hysterosalpingogram. They'll flush essentially like a fluid through the tubes to clear them. And women will usually have, if they have patency, they'll be able to see that with the dye. They'll be like, your tubes are patent. But
what does that mean?
Basically, they're clear.
Okay.
And the flushing process itself can kind of clear out some debris and make it easier for women to get pregnant. So there's a higher risk of getting chance or risk, depending on if you want to get pregnant or not, of getting pregnant after a hysterosalpingogram. So that is some imaging that can be really helpful if people have been trying and they feel like their hormones are great and there's just, right, this more of unexplained fertility. That's definitely a next step. But I would say, like, I almost rarely have to order that because it's really, right, it's more rare that that's the cause.
It's usually root cause based in terms of something that's out of balance in the body, some inflammation.
Yeah. And that's really, that is work that like a fertility clinic, a reproductive endocrinologist will often run. They will do imaging, they will do that type of work, but what they're not going to do, what a advanced reproductive technology clinic is not going to do is give you your fertility. They're going to be like, how can we get around the problem? So like, is there something blocking the egg? Like, is there a reason that the sperm can't get out of the testes? They're looking for more structural causes, and then they just, are you not ovulating? Can we synthetically induce ovulation, right, with these medications? But fertility clinic is never going to give you your fertility. They're just going to get around the issue.
Yeah, it makes sense that they're doing the structural imaging because that's where they can operate or work structurally versus that root cause. Let's figure out why you're inflamed.
Yeah. And so regardless, like I'm not really attached. I mean, I think most women they prefer the natural birth method, but I'm not attached in my practice to like if somebody wants to go through IVF or not, or, get pregnant naturally. I'm more like the trimester work is important either way. Yeah. Because if you're going to go through IVF and there's a 1 in 3 chance it works and it's very expensive, like you want to optimize and make sure that that investment, has a greater outcome.
Yeah.
And even more importantly than that, like the genetic influence, like passing on a better genome to your baby is not going to be something that the IVF clinic can help you with. Like that's only something that the trimester work can do. I just want to touch on that a little bit more so this is really clear to people. Like we get our genes from our parents, right? And we can't change our genetics essentially in a sense. Like we can't change the chromosomes we were passed, but
we can't change that we have brown hair.
Right.
Yeah.
Well, what we know is that like there's this term genetics load the gun, environment pulls the trigger. And I think it's really important people understand that. It's like, yes, you could be predisposed to having high cholesterol or certain conditions based on your genes, but genes are kind of like they have a volume level. So it's like if you have a speaker and you can turn up the volume and turn down, you can turn up the expression of your genes and turn down. So when you're doing trimester work, that's the goal is like you want to turn up all the beneficial genetic expression that you're capable of and you want to turn down all the potential pathological and, problematic genetic expression you were given. And you can do that, through your diet and lifestyle and environment and all that. So that's what we're doing in the preconception work is like influencing our personal and our partner's personal genetic influence so that we can pass on the best set of genetics to our baby so that they are set up for success, and they don't have to work so hard to like turn up or down whatever they need to have a healthy expression in their lifetime.
So in just that 3 or 4 month period, you can quite literally change the genetic expression of the egg and the eventual child that you're going to have. That's unbelievable. I want to talk about how to do that because I think we could get caught up in like looking for the reasons why things are so bad for so long, but you just have so many solutions for us, and that's where I feel so much hope for folks. So let's start talking about how we actually change those genes. What does that mean? Is it that nutrients are turning on or turning up certain genes? Is it stress management? And then I also want to talk about this like spiritual aspect of the lineage and even the grandmother and that epigenetic.
Yeah. Let's start there because there's some really interesting research. There's a really brilliant scientist named Dr. Cleopatra Camperveen, and she's a fertility researcher. She has a fertility institute, and she has, and her research has seen that, through our thoughts, we can influence our epigenetics. So like her number one recommendation, which I wholeheartedly agree with, is that we need to change the way we think. And so this is like not what most people think they're getting into. Maybe when they come to a naturopathic doctor, like a lot of people are like, let's do the labs and I do that, and that's important. But this is why like starting a little earlier than 4 months, because as we all know, like it's hard to change these lifelong patterns, right, that we were shown. It's like in neuroscience from 0 to 7, we're just sponges. We're absorbing everything we see in our world to figure out how do you act if you're a woman? Like, this is how mom acts to dad. This is how mom acts to the postman. This is how mom acts to my teacher. Like, this is how a teacher acts. Like, we're just taking in programs that aren't really authentically ours to try to figure out how to be in the world. And so that can look really different depending on what type of environment you grew up in, and lifelong work for most people is trying to shed that. It's like trying to figure out who you are authentically you, like who you are, Olivia, who am I, Elizabeth, like not what did I learn from my parents, what did I learn from, the primary people in my life growing up, but like figuring out who I am. And so I think this is something that I really encourage couples to do is like think about not just like that bigger, deeper question, but like, how are you feeling mentally right now? Do you have space in your life for a baby? Like that simple question. Is there space for a baby? A lot of people are really busy. Everybody's really busy, right? Everybody's trying to do a million things. Is there space for a baby? What is your life going to look like if you had a baby right now? Is there space to take care of a child? Most people, the answer is no. So it's like, how can you get in the pregnancy mindset now? Like, I'm pregnant now. How can I create a life where there's space for this, to welcome this child? And then in that work of like identifying like, where don't I feel safe, in my life? Where, what patterns and programming do I have around birth and what it's going to be like, pregnancy, and what it's going to be like, my potential for fertility, and what that's going to be like based on maybe my siblings or my mother or my grandmother or whatever is in our family line, right? And there's a million ways to work on that, right? And try to clear that. And there's so many beautiful practitioners, just so many. Like, there's so many routes right now to support nervous system, but getting some type of nervous system support in the year, or ideally before you conceive, so that you can be as solid as possible, right? Going into...
So it's like belief hygiene. I was just talking about this, where your inner voice, we don't realize, is usually our mother's. We think it's our inner voice when we're being mean to ourselves or criticizing our bodies or whatever it is. It's helpful to stop and ask, wait, whose voice is that? Did I hear my mother criticize her in that way? And am I internalizing and taking that on? And that is the work, like you said, is who are you? Differentiating your voice. And I feel like it sounds to me, and maybe this is just because it's my personal hyperfixation, but I think solo trips, time with yourself before you have kids, not just trips with your husband or partner or friends, but solo trips, even if it's upstate into nature for a weekend, to figure out who you are and hear who you are and be your own friend and identify your voice, almost seems like a bit of a fertility practice.
Yeah. And hyperfixating on your physical health can be a form of disassociation from your nervous system. So, we will disassociate from things that make us uncomfortable. It's natural. It's like, it's uncomfortable, so we want to move away from it. And so it's really common that people are like, I've done it. I do it. I can be very guilty of that, where my doctor's like, you don't need to do anything else. Like, you just need to chill and go take care of yourself, do self-care, go get a massage, And like, sometimes I'm just like, aren't you going to give me like a plan? She's like, you do too much. Like, you're already doing so much. So this is like the way, a lot of people are very action oriented, and it can be really uncomfortable to sit with these truths around like, what is, like, I didn't know my birth story until after I had my first child. And then in between pregnancies, I did this work on my inner child, and one of the exercises was like, how was your mother's birth with you? How was your mother's pregnancy? And I was like, I have no idea, and I had to go ask her. And it was like a little hard uncovering like some of the things that she shared, like what traumas how was her pregnancy? Did she feel supported? Was there any major stressors or traumas that happened? And these babies, like, if you think about the fact that, when your grandmother was pregnant with your mother and she was 20 weeks gestation in your grandmother's body, your mother had all the eggs she will ever have in her life. So you were in there. We've been here, your babies, whether they're earthside or not, like they've been listening. They've been impacted, from all of these things. So like they know you intimately. Like, they're not just like getting to know you when they come out of the womb, right? They already know you. They already feel everything. They feel your thoughts. They feel your hormones. So, this is preconception work where I say, like, I feel like mine really began probably when I was around like 25. I didn't know it. I wasn't cognizant of it, but that was really when I started to like really look at my health, in a more critical view. And every year there forward, it became more and more peeling back different layers. But, not until like, maybe the 4 or 5 months before I had my first child, I was like really intentional about certain supplements and all that. But it's too much work for somebody to do in like 4 months. I mean, you can, right? You totally can, but you have to kind of decide like what type of person are you? Do you like to just dive right in full force and like, can you take on a bunch of things at once, working on your mental health and, starting an exercise routine and changing the way you eat and taking supplements? Like that can be a lot.
It takes time. Yeah, you have to do just like one habit change at a time. Otherwise, it's extreme and it doesn't work. And
and people get
the inner
burnout.
rebel comes out. Because like you just mentioned inner child before, which I think is really beautiful.
Yeah.
I've been doing so much inner child work. I'm like, my next step in life is to develop a framework using art and herbalism, but art to help people develop a relationship with their inner child. I think that's so important, as well as their inner mother, because often our inner child felt unseen by our mother. So repairing that relationship and then letting the inner mother take over, I think is so important. And maybe that also helps to usher in the inner mother within us that can then go on and have children. But it just reminded me of what you said about how we kind of hear everything even before we exist, sort of as a born child. We hear everything in the egg form, because a friend of mine used to say that her mom had a teen pregnancy with her, and her mom looked even younger than she was. And so she felt so much shame when she would go out in the world pregnant or with her baby. And she, all throughout her life, didn't understand why she was feeling so much shame around her existence and so much rejection as a human until she asked her mom, what was it like to have your teen pregnancy? Like, how did you feel? And then she found that all of the internalized feelings that her mom felt are the feelings that she struggles with on a daily basis as a human who doesn't feel worthy. And that leads into her inflammation physically. I could literally see it in her with her pad. It's just amazing how that works. And it's kind of like, how do you go back and retrace that? Maybe you just identify that shame is your wound, and then you do all the work to take up as much space as a human as possible,
and the brain is neuroplastic, so you can do meditation and get into a theta state and start imagining what you want to feel, versus like you can journal about what you actually are experiencing, and then you can go into meditative state and actually like imagine what you want to feel like. What would it feel like to have the most safe, blissful birth where you felt so safe and supported, or such a safe pregnancy, and like really imagine that. And when you do that over time repeatedly, you can rewire your brain. Like we have neuroscience supporting this. So, but it's hard work, and it doesn't happen like with one meditation or one, conversation. So this is where the work that Dr. Cleopatra has done is just so impactful, because she's actually proven that like your thoughts can impact your epigenetic expression. So we're talking about the science of like changing our genome for our baby. Like, I think this is where we need to start. It's like mental, emotional, physical health.
And then omega-3s.
Like that's like the easy thing. It's easy to take a supplement, I mean, it can be cost prohibitive, it can be very costly to take high quality supplements for sure. But if you have the resources financially, that's easy. But this is the bigger work. And the last thing I want to do is make anyone ever feel overwhelmed, because none of this is like easy work or can be done overnight. But if you want to have children at some point, like it's just good to start thinking about like these are the different layers, and maybe identifying like where do I need the most work, and just pick that category, because it is this constellation of things that affect fertility. Fertility and health are very synonymous, so it doesn't, this doesn't really pertain to just people who know they want to get pregnant in the next 4 months. It really pertains to anyone who wants to be in the best expression of themselves and, potentially might want to have a child someday. So this is stuff we can just start slowly chipping away at,
I love that. And I really do believe it all boils down to the inner child work. I think that's what I'm finding is like the solution. Obviously, the somatic nervous system regulation, you have to also retrain that autonomic nervous system to feel safe in the world. And so working with somatic practitioners or different methodologies that can get you out of fight or flight habitually is great. But I think at the end of the day, to sort of keep that, you have to develop that relationship with yourself. And you do that through relating to your inner child. And that almost breaks the cycle. If your grandmother had a strained relationship with your mother and you were in her, and then your mother had a strained relationship with you, you can't go back and change their relationship, nor can you force a change in your relationship with your mother. All you can do is cultivate your inner mother that can heal your inner child to break that cycle. And I think that's where the future is.
Yeah. And this idea of like remothering yourself. I mean, I tell every patient I work with, like, you know, and this is where I think like nutrition, it's like if nourishing yourself is an act of self-love. Like if you're having a hard time feeding yourself, if you're having a hard time like cooking meals for yourself, or even eating, you know, so many people just skip meals because they're like, I'm busy, you know, I skip lunch, I skip breakfast. And it's like trying to reframe, like, this is a way that you show yourself you're worth it. Like you wouldn't not feed your child breakfast.
Feed yourself,
you wouldn't neglect your child, like basic needs of feeding them, you know, like most likely you're not going to give your child like a bar just for lunch, you know, so maybe every once in a while, like in a pinch or whatever, you know, no shame on that. But you have to mother yourself. You have to like show yourself that you are worthy of taking the time, you know, of your week to feed yourself 3 nutritious meals, you know, hopefully most days, and really view that as an act of self-love and self-care. And I do think that can be a block for people, is just like, you know, not being able to really love themselves as fully as like, you know, they can pour all that into their children, but they neglect their own needs. And this is just like, it's an important piece of the whole spectrum, you know, because it's not just getting pregnant. It's like having a healthy pregnancy and, you know, hopefully having a healthy, you know, non-traumatic birth and a good postpartum period. And so all of this stuff will just trickle down, right, if you work on these foundational pieces through all of those phases. And then the way you're able to show up in motherhood, like not from a depleted state, not with having all those wounds being ripped open, because your child is there to help you heal them, and they will rip them open for you whether you want it or not. So
I've heard that kids just trigger those deepest parts of, like, they're your mirrors.
They are.
So you got to have a little bit of a relationship with yourself to have the armor. And to your point, even if you do end up having a traumatic birth, which a lot of women just don't have control over, if you have that relationship with your inner mother, if you've mothered yourself and you've learned how to actually speak to yourself, check in with yourself, what do I need right now? And you just learn to break that neural pathway of self-sacrificing and self-erasing to take care of others. I think even if that traumatic birth were to happen, then you can speak to yourself through it. You can speak to yourself after it and say, hey, that wasn't your fault. That was not your body that did that. This just happened to us. How do we feel? Let's feel it. Let's do this together. You know, you can just have that internal relationship. And then, it sounds like postpartum, it also will help you to still be in touch with your needs, as your whole life soon revolves around meeting the needs of a helpless little baby. Wow. So let's get into the specifics, because that's a beautiful, like, high-level, spiritual, juicy moment about what our souls need, preconception and also postnatal and everything. But I want to really give people the tools of specific things that they can do now, whether it's specific lab tests, specific supplements that can across the board maybe lower some inflammation and replete some nutrient deficiencies that are common, like omega-3s that we just mentioned. So let's talk about labs since we're on the topic. Because the other day a friend of mine was running some labs for me, and she said, we should run AMH if you want to know your ovarian reserve. Mm-hmm. And I instantly clammed up and like got so scared and was like, oh my God, my reserve, like it's all I have. Like, what does that marker mean? I didn't understand it. And even testing it felt so scary to me, because I'm like, what if it comes back, quote, bad? And I think there's so much fear out there around women who are maybe getting their labs done for the first time. It feels really intimidating. So what does AMH mean? Do you need that lab? And what are the other labs that you always recommend people run for preconception?
Yeah. So AMH is anti-Mullerian hormone, and it is this measure of your ovarian reserve. And essentially, like, there's different reference ranges for age groups, but you want it somewhere between like 2 and 6, 2 and 8. So when it's really high, it can be an indicator of PCOS. And when it's really low, that can be an indicator of like really poor fertility potential.
Why is that? If it's low?
If it's low, because it's essentially indicating that you don't have a lot of like good egg quality
So
left.
That's what reserve means.
Mm-hmm. Okay. Yeah, there's an antral follicle count, which is actually like part of an imaging. They can do a transvaginal ultrasound on day 3. They can actually do a count of like how many eggs are in your ovary in that month, or they can test this ovarian reserve blood level, which is the AMH. I had an AMH done when I was 30. My first year of medical school, I had an ectopic pregnancy. It was very scary. I lost my right fallopian tube. I was terrified. It was like, I just started medical school. I'm 30 years old. I don't want to get pregnant my first year of medical school. Now I only have one fallopian tube. Like, I was freaking out. And my sister was having trouble conceiving, so I was in this state of panic about my future fertility. And I had a naturopathic doctor run fertility labs on me. And I don't exactly remember what they were, but I remember her telling me, like, they're not optimal. And she started asking me, like, what age did your mom go into menopause? What age, and that sends you on the spiral. For me personally, having had that experience, like, it did push me into trying to learn everything I could to, like, preserve my fertility and become a fertility expert. Like, that was the event in my life that, like, pushed me on this trajectory. But I don't now in my practice. I think my experience influences the way I practice. Like, so if a woman is just coming to me and they're like, I just want to preserve my fertility. I just want to make sure I'm healthy. I just want to be doing everything I can to optimize my health, but they're not necessarily want to try in the next year or two. I don't recommend running AMH because psychologically that can just cause so much more stress to, like, see that level and then start stressing about it. But if a woman's coming to me and they've been trying for a while within the criteria, like 3 to 6 months, is like what I would say, they've been trying and they're not having success, then I do run it because it can really justify the need for further supplementation. I will use N-acetylcysteine and CoQ10 and melatonin, and those 3 nutraceuticals have been, like, clinically shown to improve AMH levels.
Does it improve because it's improving follicle health or egg quality?
Yeah,
okay.
and melatonin is linked to your cortisol and DHEA levels and your circadian rhythm, and so that can actually, like, really influence how you ovulate. I had this, like, amazing story. I thought I was going to, like, just be able to cure every infertility patient that ever came into my office because my sister was about to use Clomid, and I learned that melatonin can be really helpful in my gynecology class at school, and she was like, called me. She's like, my doctor prescribed this, and I'm about to, take it, but I just, like, have this feeling that I shouldn't. And I was like, why don't you try melatonin? It's really cheap, like, just 3 milligrams. I, like, gave a recommendation, got pregnant the next month. And so I was like, oh my gosh, like, it's going to be so easy to do for infertility work. I'm just going to give everyone melatonin. And it, like, has not panned out that way, but it does really help. And the studies around NAC, melatonin, CoQ10 show that they can be as effective as Clomid. So that's a common ART drug given to women to help stimulate ovulation. CoQ10 can be quite expensive, like at the dose like that most reproductive endocrinologists recommend using based on the literature is like 600 milligrams, and that's a pretty expensive supplement. So if somebody is like trying to weigh like what do I need most, getting that AMH value can show that. Like, and then if a woman's over 35, I usually recommend those supplements anyways because we know it affects the way that follicle develops and the maturation. And because there's such a higher risk of miscarriage, and usually that's chromosomal abnormality. Like, I didn't test my levels with either of my kids. I just was like, I'm going to do everything I can to improve the quality of my eggs. I don't want to stress about it. So it's individual based on the person's stress and how much information they want.
That's a really helpful, comprehensive, nuanced view on AMH, and I appreciate you keeping people who have some anxiety about that in mind. I love that that's the way that you practice. And so with that said, say that there's a woman coming in who wants to get pregnant in the next 1 to 2 years. What is the full lab panel that you're running on her?
So I am looking at on cycle day 3. This is really important for people to know. Cycle day 3 is when you want to test your estradiol, your FSH, and LH. I can't tell you how many times women have gone to their gynecologist and they run them whatever cycle day they're on because they're in the office. And I'm like, we can't utilize this estradiol level. It's not run at this right time, or the follicle stimulating hormone specifically. I mean, there are some other reference ranges for estradiol, cycle dependent, but the lab ranges that work best for us to really interpret the data are cycle day 3. And that's, cycle day 1, first day of a bleed, not spotting, and then day 2, day 3. So you'd go on day 3.
Why is that? Because isn't estrogen falling at that time?
It is, but that's like, we want estradiol to be under 45, above 25. And so that's like, we can clinically use that time of month better than, like, the Dutch test will do 5 to 7 days post-ovulation. That's urine testing, metabolites of your hormones. And so they are looking at estradiol later on in the luteal phase. But the general standard in medicine is to run day 3 labs and to use those reference ranges as like a gauge of how to diagnose estrogen dominance and things like that.
Okay, so that's what you're looking for. If the estrogen's high there, estrogen dominance.
Yeah, and FSH and LH, I mean, those are only produced in the follicular phase when follicles are developing. So if you're testing them in the luteal phase, and I've seen so many women who've had their progesterone tested in their follicular phase, which you don't make progesterone until after you ovulate. So, it's like a 0, and they're like, I'm low on progesterone. It's like, well, you didn't ovulate yet, So ovulation, they will say day 21 if you're having a 28-day cycle with day 14 ovulation, but this is where cycle tracking learning your cycle, learning how to pinpoint ovulation is really helpful, so that you can go in on the correct day, which is like 5 to 7 days post-ovulation is when you want to test progesterone. So those are like basic hormones. DHEA and testosterone are other hormones that I run. DHEAS can, especially if it's low, people always are worried with PCOS of it being high, but if it's low, that can impact fertility, certainly can cause infertility. Testosterone can definitely mess with estrogen levels because there's an enzyme that converts the two. And insulin, fasting insulin is major. That, people will often get a hemoglobin A1C, which I still think they should usually get, but
mine was not accurate.
Yeah.
I was 4.8 in pre-diabetic. Like, what are you talking about?
Yeah.
My fasting insulin
The
was
fasting
like
insulin,
14.
right, will be off before you'll see the A1C affected, before you'll see the fasting blood glucose, even on a comprehensive metabolic. So that comprehensive metabolic is called CMP. That is in my lab panel, CBC, which looks at your red and white blood cells. We'll do a cholesterol panel to look for, high cholesterol or even low cholesterol. Not having like a total cholesterol over at least 150 can be problematic because all of our hormones are made from pregnenolone, which is made from cholesterol. So, not having fat in your diet or restricting diet or over-exercising, those can also be reasons why people will not ovulate and not have good hormones. And then a full thyroid panel, which includes, TSH, free T3, free T4, thyroid antibodies, reverse T3, and AMH, person dependent. That's one that, like, if you don't have the ICD-10 code where you can code for infertility, it often won't get covered. That's a tricky lab to get covered and can be expensive for insurance purposes because usually insurance won't even cover fertility stuff. And then, sometimes I'll do more extensive nutrient panels. B12, B12 I would say is as important as folate. People know about, folic acid or folate being important, but B12 is really important. It's estimated that like half of infertile women have low B12 levels, and it's implicated in miscarriage and infertility. And there's some really, really interesting studies on B12 and how it's related to infertility. It also plays a role in the neural tube formation and essential organ formation. And because those organs are forming at like 4 weeks gestation, which is when you're finding out you're pregnant, like if you're not sufficient in those, it's hard to get nutrient values up quickly. You can get a B12 injection, but, if you're taking them orally, it's going to take a while for you to really absorb and get your blood levels up. So I will sometimes run B12 levels. Intracellular B12 would be optimal versus like a serum B12 level, but that's like a non-out-of-pocket lab, so that's sometimes not always accessible for people. But that's like the basic panel.
What about for men? Are the labs going to be different?
For men for cholesterol?
No, I mean overall.
Overall, testosterone is big, and they need to do that in the morning. And men have, struggle a lot with, that's really implicated in how the sperm are developing, spermatogenesis. And so testosterone levels are really important. And there's some great herbs like ashwagandha and things that can increase testosterone for men. So definitely identifying that is important if they have low testosterone. And then the ratio of like testosterone to estradiol to FSH, it can indicate certain issues with male fertility, which is more like nuanced and specific, and that's covered in my course. But yeah, and then sex hormone binding globulin is something that I will add for women and men that I forgot to say in the women portion, because that can influence the testosterone and DHEA levels. But it's similar, yeah.
And then obviously, other than things like vitamin D or like an RBC magnesium or a B12, like you said, we can't always test for nutrient deficiencies, right? So what are some of these nutrients that we want to be including more in our diet for both men and women? Preconception, obviously you mentioned those mitochondrial helpers like the CoQ10 and you said CoQ10, melatonin, and NAC. Okay. So what are these nutrients that we want to be focusing on preconception? And how do we know if we may need to supplement some of them?
Yeah. So, most people know prenatal quality is key. So prenatal that has methylfolate, methyl B12, ideally has B6 because that's going to be really important for healthy hormones. We really want prenatal to have choline, or if not, take additional choline, because that's really important for the baby's brain development. That's something that I would say is newer of the last 5 years, but still there's a lag in people's education around that. So, reproductive endo or, whoever you're working with, prenatal care team might not recommend choline, but you definitely want good amount of choline. And you really can't get it through diet. Like eggs are the highest food source of choline, and there's like 120 milligrams maybe in 2 eggs or in 1 egg. And so if you eat 2 a day, you can only get like 200 milligrams.
Why is it that we need so much of it, but it can't be consumed through food enough?
There's That's a really good question. I don't even know if I have the answer to that, to be honest. The research around choline intake now for babies, like brain to develop properly, suggests that we should get somewhere between 500 and 900 milligrams
Not
of
getting
choline.
that in cauliflower.
Right. So, yeah, I mean, where's the disconnect there? Evolution-wise, that's a really good question
Did
that
we
I will
used
look
to
into.
eat more like fish roe or?
There is choline in organ meats, so potentially the lack of organ meats in diet. I really love giving, if people can eat organ meats, having them eat them, and if not, giving a really high quality like grass-fed organ complex supplement to get fat-soluble vitamins and choline, and
I mean, same with vitamin A. There's no way you're getting your vitamin A, your optimal retinol, let's say. You can get enough beta carotene, but we can't all convert it to retinol, which is a problem. But there's no way you're getting your optimal vitamin A, aka retinol, intake through egg yolks either. You really do have to eat liver. Like, I'm realizing more and more, if I could just do a few things, it's inner child work, eat liver, wear my blue blockers, balance my circadian rhythm, and like hug people more. Like, that's really my plan.
spend time outside.
Yeah, spend time
Connect
outside.
with nature.
100%. But yeah, so you kind of need, because I'm sure the vitamin A is important too, just because also for thyroid function, and you kind of need to eat liver. It's a fertility food.
Yeah, it's a great food. It's really hard. I like to support people, whatever their ethical or dietary preferences are, where they're at. But it's really hard to get all the nutrients you need on like a vegan diet, because of the lack of choline and different things like that are only found in animal food sources, fat-soluble vitamins and things like that. There's a lot of implications of low vitamin D and, autoimmune disorders, issues with even ADHD, and there's some interesting research around that. So vitamin D for sure, giving levels optimal and usually supplementation, a good probiotic, working on your gut microbiome. We've talked about that very briefly. I really encourage people to go back and listen to that other episode, but you talk about the gut microbiome extensively as well in all your work. But it's hugely important. I mean, we are more microbes than we are human cells. Our gut is running the show. Our bacteria are running the show. We can't survive without them. They influence everything in our body. And, regardless if we identify with having GI issues or not, like every chronic inflammatory condition, every chronic disease ties back to the gut microbiome. So you just have to work on your gut, and the better gut you have, the better gut you're going to be passing on to your baby. So high quality probiotic.
So prenatal, choline, vitamin D, high quality probiotic.
Omegas would be
omega-3s. That would be like your top 5.
Yeah.
Okay, I love that. Why omega is just follicle health / metabolic.
Yeah, they can be really good for balancing cholesterol levels, so making sure your HDL, like the LDL and triglycerides, are more quote unquote the bad cholesterol, but they can bring the good cholesterol up and lower the bad ones. And it's really implicated in healthy egg development, and can be very good for PCOS and driving down inflammation. And
I want to get into your course and the fact that you also talk about these dietary pillars for just parameters for eating around optimal fertility and health, because obviously we're talking about supplements. Again, that can be cost prohibitive. So I want to talk about food. And I just wanted to mention, when you said high quality probiotic, something I've been very into at this stage of my life, because I'm also thinking about my preconception and fertility, is the vaginal microbiome. So not just the gut, but the vaginal. And we actually just released, by the time this episode comes out, Flora V, our new vaginal probiotic for women that has cranberry in it. So you get a dose of the antioxidants, but also microbes that help to support the gut and the vagina and the urinary system as well. And I know that the microbiome matters for our fertility, not only for our chances of healthy fertility and full-term pregnancy, but for what we're passing on to our baby. So we're going to put our Flora V female probiotic into a bundle with like our Natal Nourish prenatal formula, so that moms kind of have that herbal and probiotic support that's specific to fertility. And then I want to get into your course, which I think also is an amazing investment for women who are in the preconception trimester phase. I'm about to start your course with my husband. We're just going to go through it together. And everything we've talked about in this episode regarding all of these lab tests, the factors that you want to look for, finding your own root cause, is all expanded upon in your course. And as I mentioned, you also talk about these dietary pillars. So can you expand a little bit on what we can learn regarding diet in your course too?
Diet is going to be individual. I don't believe there's any one right diet, but I do think there are pillars that every diet should have, which is whole food based. The less processed, the better. The most diverse, the better, because that's going to feed a wide variety of microbes in your gut. It's going to allow you to have a diverse microbiome, which is one of the strongest risk factors of having poor gut health, is if you have low diversity in the gut. So, eating the rainbow, eating different, if you go to the grocery store and love apples, like get different varieties, just get different varieties. Get the purple cauliflower at the farmer's market when it's in season, just pick up different things and just try to always be diversifying diet. Eating plants is very important. I think that having the macronutrient pieces in line and making sure that the way you digest your food is important. So a lot of people struggle with digesting plants because of the fiber, and a lot of people struggle with digesting protein because of their inability to maybe have enough stomach acid, or they can't break it down fully, or they're constipated, and so they have excessive fermentation of protein happening in their colon by the bacteria, and that produces all these byproducts of protein fermentation like ammonia and phenol and polyamines and histamine that are really inflammatory. So, one of my other areas of expertise, which came later in my career, was becoming this gut microbiome enthusiast. I'm just obsessed and I've been researching the gut microbiome for years, 5-6 years, deeply, and speaking about it at conferences, and the connection between the gut and the brain and the gut and your hormones. I've written many, many papers. For a couple years straight, every month I would just pick a topic that I was seeing a lot in clinic and then dig into all the research of how that condition was being affected by the gut microbiome and write a paper on it. And there's no condition yet I've found that isn't linked to the gut. So that's why I'm just this is such a big piece, right? And diet is so intricately related to that, because sometimes it's hard to make these blanket recommendations. And I think this is where people get really confused, because they're I'm supposed to be eating vegetarian, or I'm supposed to be eating 30 grams of protein every meal. But it's how do you feel when you eat a heavy plant-based diet or a heavy meat-based diet? How are you able to digest those foods? So yeah, with diet, I think those are just the pillars. It's eat whole foods, balance your blood sugar is important. But if you're noticing that you feel a lot of indigestion after eating a high protein meal, if it really just doesn't feel like you're digesting, if you're constipated, that's where we need to really work on optimizing your ability to actually utilize those nutrients and get the benefit of them, right?
It is so individualized, and it sounds like overall your theme is really plants and protein. It's really diverse plants, the amount of protein that you can handle, obviously aiming for the 30 grams for satiation and balancing the blood sugar, but listening to your body. If some days that's not working, some parts of your cycle maybe that's not working, listening to that constipation factor. And then also healthy carbs, obviously fibrous carbs, but healthy carbs. You need carbs for your hormones and your thyroid.
Yeah.
And then the other piece is fats, because in your course you also talk about the types of fats that are needed for healthy fertility. Are there certain fats we should be eating more of?
Yeah, there's this acronym I use, SMASH, and it's salmon, mackerel, anchovies, sardines, herring. And those are the fish that are highest in omega-3s naturally. And so of that list, people really only eat the salmon and sardines maybe, mostly, but you can get pickled herring or canned herring. People might eat those foods, but if you are eating 3 servings a week, ideally, of those foods, you might not need to supplement with an omega-3, right? But if you're not, then you definitely should supplement with omega-3 to get the healthy fat ratio. And then, I am a big proponent of, seeds, using, flax seeds and chia seeds and sunflower seeds and pumpkin seeds as a source of healthy fat, and olive oil unheated, extra virgin olive oil unheated, I think is great. So I'm definitely not fat phobic or even seed phobic. Yeah.
Do you have 5 foods that you'd love for people to ideally be eating that year before conception?
Yeah, totally. Broccoli, really good for detoxing estrogen and helping estrogen levels. I would put flax in there too, because flax can kind of work. It's a phytoestrogen, and it can increase your estradiol if you're too low, or lower your estrogen if you're too high. So it has this adaptogenic effect, which is really cool about flax, and it's really good for the gut. I would say cranberry, or some really food rich in bioflavonoids, tart cherry juice, or, but cranberry is probably the number one, because we see it increases a strain called Akkermansia, which is a keystone species that's super important for your gut and your metabolism and the gut lining, your short chain fatty acids production. So yeah, cranberry, people aren't eating that a lot. Salmon, protein, the omega-3s, if you like salmon. What would be my 5th one? Liver.
Perfect. And then can you also share 5 nutrients, foods, supplements, or herbs that men should be taking before conception, especially if a couple's having trouble conceiving?
Yeah, so for men, folate is really big as well. I would say omega-3s and probiotics, and then some antioxidant blend with ashwagandha. So I use a male fertility kind of blend supplement that has NAC, CoQ10, green tea, and ashwagandha in it, and it's a really great blend for male fertility, and it kind of hits all of the parameters for, if you have low morphology, like bad shape or poor swimmers or, low count, kind of one of those ingredients will impact, all of those parameters. You kind of cover your bases.
Love that. Okay, so please tell us all about your incredible course.
Yes. So I created this course, Fertility Reclaimed, because I had a daughter a little over 2 years ago, and I feel like she has really, she's really reminded me of the importance of like reclaiming my like sovereignty around my fertility and not just my potential to get pregnant, but the whole process through birth. Like my birth story with her was life-changing on so many levels. Like I'll just cry if I even share about it, but it was, it truly changed my life. And she's just like clearly here to teach me about my power. And that's really what's in the name. It's like, I think it's every woman's birthright. Like when I had that ectopic pregnancy my first year of medical school, I was on hormonal birth control, like many women. I didn't know anything about what it did to me or, how it changed my hormones, my thyroid, my gut. Like I was just put on it, in college at some point, like and just told it could cause, issues with like clots if you smoked, but I didn't know anything about it. And I had just been kind of taking it blindly for a decade. And I took it wrong. I took the placebo pills instead of the actual pills, and I got pregnant. And so I had this ectopic, unplanned pregnancy, and it was very traumatizing. And I didn't want to go back to hormonal birth control after that. I was just like, I don't really see the options. And, there's the IUD, non-hormonal option, but IUDs can cause ectopic pregnancy. So I was like, that just doesn't feel like a good option for me because I don't want to have this increased risk of a future one. So that led me to finding fertility awareness, which is a method of like tracking your ovulation through temperature and cervical mucus. And it was the first time in my life that I was ever taught anything about my menstrual cycle. And, it was the moment, it was a year-long process for me to really trust that I could actually be in control of whether or not I got pregnant, and not relying on hormones or birth control, right, to do it for me. So it was this huge year of unlearning and, kind of unleaning on this, option from the medical system and really reclaiming my own fertility that completely changed my life. And, because fertility awareness changed my life so much and I was so empowered by learning that information and kind of, taking my, contraception back in my own hands, I, brought fertility awareness educators to my school and, because we weren't learning this in medical school, even as naturopathic doctors, and, would host training weekends for other students to learn and got really big into that. And I taught for many years fertility awareness programs myself out of school. So that was kind of like the first step. And then it's like now we're seeing fertility levels decline, and so many women don't, they aren't given like a lot of options, right? They're just like, you can take Clomid or you can take, these medications, or you can do IVF or IUI, but, they're not really given a lot of information about like, why is their fertility not doing well, or why is their partners, or what they can do to feel better and reclaim their fertility. And it's hard. Like my practice got so busy for various reasons. One of them probably being on your podcast a few years ago. I had to close, my practice to new patients for most of last year. From January to October, I didn't see new patients because I was so busy. It was like disservice to my current patients. They couldn't get in to see me. And I was like, I need to create something that people can access to get this information, and I've just dedicated so much of my career to researching this. I'm a double Virgo, I love information. I just obsessed with I'm just hungry for answers and consuming information and learning. And I just wanted to compile it. So I created this evergreen program that's like 5 modules where people can just get, very detailed, information about like each step of the way of like what you should be thinking about with your preconception health, and how to do that, like actionable steps of like, these are the labs that you should be getting, and these are the lab values so that you know how to interpret them. These are the optimal ranges versus what like your lab reference range might say. These are the conditions that might cause it, and here's what you can do from like an herbal or dietary or lifestyle standpoint. So it's not the same, obviously, right, as working one-on-one. We talked about at the very beginning, bringing this full circle. Like if you have the option to work with someone one-on-one, that's always going to be the best scenario. You want somebody who can be your coach. You don't have to do this alone. It's the power of that relationship is strong. But if you, can't afford to see a provider for one-on-one care, or haven't found the person you want to work with, this is just a great option to give you access, at a very reasonable price to all this information, that I've been accumulating from all of my research and clinical experience over the years. So,
and maybe someone can do your course first, see if they can make progress there, and then also learn about their own root causes through the course, / have the information to bring to a physician or a practitioner that they choose to work with. They can just kind of have that knowledge base so they can advocate properly. So I think it's just a really nice introduction to anyone who's starting to learn or finding that they're struggling with fertility and they just want that knowledge base. I think it's such a beautiful resource.
There's such a big gap in education, and so many women tell me like, I feel so embarrassed and that I didn't understand my cycle, and I don't actually I don't know what's normal, and I haven't even been paying attention, and it's not your fault. It's like we should be taught this in sex ed. Somebody should be teaching this along the way to us, and it's not for whatever reason. And so, it's just, there's so many people bringing awareness around this, and I'm just so grateful, to be in this field. I feel like this work is, it's life-changing for individuals, and it's just a way to like make an impact. It's like, this is a way that you can live a better quality of life, feel better in your body, have best mental, physical, emotional health, and then passing on the best genetics to your baby and your grandbaby is like, what a gift. It's just, we prep and plan for so many things, weddings and school or careers. There's so many things that we'll invest time and preparation for. So why not our children and our grandchildren? Like, it's sometimes hard to get people to like invest in something they don't even know that they need, right? So it's just like, thank you for the opportunity to help me explain why this is necessary,
Thank you for creating this resource. This work is very much needed at this time where so many people are confused and just don't have the tools and the resources. And hopefully it's an each one teach one situation where a woman takes this course and then she can tell a friend and teach a friend and just kind of pass along this empowerment. So I'm just so happy to know you and be able to share this, and so proud of what you've done. And I'd love to also we're going to extend a discount on this course to the OO community who's listening to the pod. So I'll put the code in the show notes that you guys can use for a discount, and I'll put the link to the course as well. And please let us know where else we can find you.
So I'm on Instagram. I'm not the best at being active on there. I undulate between personal updates and professional education. But Dr. Elizabeth Wade on Instagram. You can join my newsletter. I don't send out a ton, but I really want to get better about that, especially sharing a lot of the research and articles I've written on the gut and hormones. I've been on different podcasts, but mostly those places. So thank you so much.
Beautiful. Thank you so much.
Wasn't that great?